regulation of heart pumping. When a person is at rest condition, 4 to 6 liter blood within 1 minute goes into the arteries. Several methods. One is Frank Starling technique or Frank Starling mechanism. Other is control of heart by autonomic nervous system. These two methods used for regulation of heart pumping. By the first method, when blood comes from veins into the heart, suppose we have a heart and blood comes from veins into the heart, it is known as venous return. What is venous? From veins blood enter into the heart. After that, blood muscles stretched. When they stretched, stretching in length of heart muscle. When stretching in length of heart muscle, muscle contracts. After that, muscle contract, pumping of the heart increased. And when pumping of heart increased, in the right atrium, the volume of blood increased, because in this after venous return, ventricles fills, muscle contract, and volume of the right atrium increased, and due to volume of right atrium, the blood goes into the arteries. It is automatically the increasing level of blood into the arteries. Blood level increased in arteries. Now, control of heart by autonomic nervous system. Autonomic nervous system, which is parasympathetic and sympathetic. Parasympathetic stimulate, it decrease the heart rate. Sympathetic stimulate, it increase the heart rate 100%. Now, what's the effect of ions of the heart? Potassium ion, calcium ion, and what's the effect of temperature? Effect of potassium ions. The concentration of potassium increase in the extracellular fluid, it slows the heart rate. When concentration of calcium ions increase, it increase the contractility of muscle. Effect of temperature. Due to the increasing temperature, fevers occurs, cardiac output increase, heart rate increase. Due to the decreasing temperature, fevers occurs and cardiac output decrease, heart rate decrease. Now we use several kind of drugs, which is propranolol, atenolol, metoprolol, uh, amyloride, spironolactone. I want to revise again this information that regulation of heart pumping. When a person is at rest condition, 4 to 6 liter of blood within 1 minute. Two method, one is flank Starling mechanism, other is control of heart by autonomic nervous system. Flank Starling mechanism, when venous return into the heart rate into the heart, muscle contractility increased, strength in length of heart muscle because due to the stretching. Muscle stretch, strength in length of heart muscle, and muscle contract, pumping of blood at right atrium, volume increased, and blood goes into the arteries. Now, control of heart by autonomic nervous system, sympathetic and parasympathetic. Sympathetic increase heart rate 100%, parasympathetic decrease heart rate. Okay. Now, several kind of drugs which we use: propranolol, atenolol, metoprolol, amyloride, spironolactone. Several ions in body that effect on cardiac output, effect of potassium that slows the heart rate, effect of calcium increase the contractility, heart rate increase. If the temperature of the body increase, fever occurs and heart rate increase. If the temperature of the body decrease, heart rate decrease. So this information for you guys. Thank you so much.